In this video, I'm going to show you one of the best forms of treatment for lumbar disc herniations and lumbar disc bulges, specifically at the L4-5 and L5-S1 level. I'm going to show you how this revolutionary treatment specifically targets the disc herniation or disc bulge using a combination of one of the highest forms of therapeutic modalities combined with what we call true spinal decompression. And not only am I going to show you this unique way to finally fix your disc herniation or disc bulge, but I'll also explain exactly what a disc bulge is, what a disc herniation is, how they differ. I'll explain why a lot of traditional conventional treatments really don't work that well or give you temporary relief at best, and how this brand new revolutionary form of care really will get you better that much quicker. Now, please make sure you stay to the end. You don't want to miss a component of what could actually heal you that much faster without the need for surgery or the need for all these drugs. And also, please stay to the very end, because if you do, I will actually give you free access to my new upcoming book, Low Back Pain Is Not a Life Sentence. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada, our nation's capital. I've been doing this for over 30 years now, author of 10 books, the founder of National Health Day in Canada, and I'm very honored to say we've been voted Ottawa's best 15 times as well. I've had the privilege to work with some of the world's best athletes, and we'd like to be able to do the same for you as well. My YouTube channel focuses on helping those who've been suffering with debilitating low back or neck pain. We're not talking about the guy who tweaked his back playing tennis last week. We really get to those people where their pain has changed their lives. Now, before I get into today's video, I'd like you to hit that subscribe button if you would like to continue to get tips and strategies that are going to help you overcome your back pain and your neck pain and get back to the life you deserve. So what exactly is a disc herniation or a disc bulge? Well, let's start with what normal should be. So this is a model of the vertebrae in your spine. So you can see the top part here is actually the body, what we call the body of the vertebrae. In the middle is your disc. So that disc is a combination of what we call the nucleus pulposus and the annular fibrosis. You don't necessarily need to know that, but the whole idea here is the inner part is more of a soft gel, the outer part is more fibrous, and its goal is to act as support and cushioning that area in there. And then you'd have another vertebrae, and this would continue, another disc, another vertebrae, another disc, another vertebrae. The yellow guys you see coming off here, okay, are your nerves. So they are coming right off the spinal cord, and that is essentially the hard wiring of your body's computer. Okay? We want your nervous system to be functioning at 100% all the time. What happens at a disc herniation is usually a combination either through injury or accident or through years of abuse. Okay? Not only does that disc actually start to thin out, but then what will happen is the disc will actually bulge. So if you take a look here, okay, you can actually see how that disc now is bulging out. And when it does that, it's going to start to put pressure on that nerve. Okay? Your body does not like when that happens. The terms disc bulge, disc herniation, disc prolapse are sometimes used interchangeably, but essentially disc bulge means you're starting to put pressure on that nerve. Disc herniation is when that tends to get more severe, and you then affect wherever that nerve goes to. So not only can that create low back pain, but depending on what level, if it's L4, L5 or L5, S1, that nerve comes down the leg, either the back of the leg or the side of the leg. That nerve also goes to anything in that area. So that same nerve goes to your bowel, your bladder, your reproductive organs. It can have an effect on all of these things. Now, why do most forms of care fail or give you temporary relief? Well, in most cases, they're really not getting to the underlying cause of the problem. And for a lot of people, they don't realize, and a lot of doctors don't realize this, it's rarely underlying cause, it's usually causes. Because it's not just that that disc is herniated. In a lot of cases, that disc has degenerated or decayed first. You have to ask yourself what things actually cause that disc bulge or disc herniation to begin in the first place. Were there spinal imbalances? Were there imbalances in the pelvis or the hip? Do you have a scoliosis that would put abnormal pressure? Are there weaknesses in there? There's usually 4 or 5, 6 different things contributing to that disc herniation. which is why a lot of standard care really is not that successful. Popping a painkiller does not fix this. Popping an anti-inflammatory may bring down the inflammation, but it's not going to correct this. You can go for various forms of therapy that will give you some temporary relief, but if you're not dealing with actually correcting all of the underlying causes of the problem, it's going to come back, or that relief is going to be temporary. It's the same reason that a lot of spinal surgery does not work. In theory, if it was only the disc that was bulging or herniated, you would simply go on and they do what's called a discectomy. You would go in and you'd actually slice off that part of the disc. The problem is that doesn't address any of the things that created the disc problem in the first place. It doesn't fix any of those imbalances, any of those other issues as well. And that's why if you look up the scientific literature, there are studies that have actually shown that the failure rate for back surgery is as high as 74%. And in fact, 1 in 3 people end up back in the hospital within 30 days. What you need to do is to actually fix the underlying causes of what created that disc herniation or disc bulge in the first place. So what exactly is this advanced form of care for L4-5, L5-1 disc herniations and disc bulges? It's something called non-surgical robotic laser spinal decompression. It is revolutionary. Essentially what it is you had some very well-meaning doctors who looked at why are we not seeing the results that we want in disc herniations. And so what they did is they actually combined 2 very well-known forms of care, and for the first time ever have combined them simultaneously. So spinal decompression is different from traction or inversion tables. That's important to understand because there are some health professionals who still think they're one and the same, and that simply couldn't be further from the truth. Traction, inversion tables, they will stretch an area. They can take some temporary pressure off the area. But what true spinal decompression does is, let's get back to this disc again, in this particular case. So if there's a tremendous amount of pressure on this disc, what on earth makes more sense than to separate that and take that pressure off the disc? That's exactly what spinal decompression is supposed to do. Spinal decompression was actually been around for decades. It was invented by Dr. Alan Dyer. He's a medical doctor, he's a PhD, he's actually a former Minister of Health for Ontario. And what makes spinal decompression so different is you're getting a decompressive effect in the disc itself. You're not doing temporary stretching, you're getting a decompressive effect, which actually is this vacuum effect that will draw fluids and nutrients back into the disc. It will actually rehydrate the disc, and you're also taking that pressure off, which even allows discs to recede. Now, the interesting thing is that a lot of standard spinal decompression still isn't as effective as it should be, because when we do this to the body, what do you think the body wants to do? That's right, it wants to go back. So this is where it's now been combined with what's called a Class 4 laser. So Class 4 laser is the highest level of laser that's approved by Health Canada and the FDA, and it's going to do 2 things. Number 1, it's actually going to, at the exact same time, it's going to ease up the musculature around that area so that when we do spinal decompression, it doesn't want to go back. It can actually adapt to the decompressive effect that's happening. So in essence, we're getting what we refer to as true spinal decompression. Number 2, most people have done damage to the areas in there. And guess what? A Class 4 laser is actually going to help to heal that damage as well. And finally, the last thing to know is we combine our non-surgical robotic laser spinal decompression with a comprehensive 7-step program. So in addition to that, because we want to look at all of the factors, we'll combine that with what's called neuromuscular reeducation. We'll be looking at specific neurofunctional chiropractic techniques to restore muscle fibers, nutraceuticals specific to helping you actually rebuild the disc as well. And of course, lifestyle protocols so that you don't aggravate it again so much in the first place. As such, we've actually seen some amazing results in our office. We have Ottawa's only non-surgical robotic laser spinal decompression. There are only 12 of these in all of North America. One of our patients who were in this morning was Jeremy. And what's interesting with Jeremy suffered from a significant disc herniation. In fact, at 2 different levels, both the L4-5 and the L5-S1. He had looked everywhere else. He was looking at surgery in Germany where they quoted him $65,000 to have this surgery done. And even after 3 months, they didn't know how much better he would get. And in fact, are you ready for this? They even strongly recommended that he donate to a sperm bank, because the risk of affecting the nerves, and remember those nerves go to the bowel, bladder, but also reproductive organs, could be so affected that they had a 2 to 4% chance that he would not be able to father a child anymore. Those are the alternatives that aren't working out there. With the non-surgical robotic laser spinal decompression, not only is Jeremy doing fantastically better, but we've been able to show on MRI, both pre and post MRI, how the disc has actually receded back. Now, if you're looking for someone who can actually offer you non-surgical robotic laser spinal decompression and you're outside the Ottawa area, remember, as I said, there are only 12 of these in all of North America, then simply comment below in the comment section, and I will do my best to see if there's someone in your area who offers this same service as well. Now, I'd like to hear from you. What have you tried for disc bulges and disc herniations, whether it's L4-5, L5-S1, or elsewhere throughout the neck and through the lower back as well? What has worked? What has not worked? What is giving you temporary relief? Are you still suffering with these things as well? If you found the information today to be helpful, or you know of people who are suffering, then please share this information with them as well. Now, as I promised, for staying to the end, you do get a free digital copy of my upcoming book, Low Back Pain is Not a Life Sentence. Please just simply look for the link in the comment section below. And last but not least, if you are someone who would like to know a lot more about robotic laser spinal decompression, then please just simply watch this video right here. It goes into far more depth, talks about non-surgical robotic laser spinal decompression. It talks about the most common causes of low back pain. Please watch the video right here. You'll find it very informative as well.